Good afternoon, friends. Today I read one important article in the Hindu's 24 June, uh, which was related to the health. The writer is described about the India's health system and its impacts on the common people. So, in this article, writer is said that about the importance of government schemes like Ayushman Bharat, health card, and wellness centers established by the government. So, the first of all, we will understand what is the universal health coverage. Universal health coverage means every people, whether it poor, whether it rich, all will get health facility at feasible cost. So that was the main motive of the government's Ayushman Bharat schemes. The second important factor is that government some changes done in the health sectors like primary health centers, sub centers, which was renamed by the primary health centers and wellness centers. So that is name changed after all the centers, and the writer is arguing that the only name changing is not sufficient because it is gives ambiguity to the people about their work of the health centers. So the main importance of the Ayushman Bharat scheme, the benefits was like most of the peoples who are poor in the country are getting the health policy coverage. That is a very positive point. Another, the health facility is accessible to the common people. That is also another important positive point described by the writer. And if we talk about the negative sides of this scheme, was that only providing the good amount of policy is not sufficient. Like if we want to maintain if the common people want to maintain his health, he required clean water, affordable health services, and nutrition and poverty. That are the major causes which affects directly on the health. So that should be improved by the government. That is the main point of the writer. And talking about the improving the health structure is like the writer was given solution that government should increase the number of nurses and doctors, increase the numbers of hospitals, because either we are providing policy coverage but we have now not that amount of hospitals and staffs. So how we can provide that services to the major people in the India? That are the major problem described in India, because we are the largest population. And lastly, the writer is arguing that only starting the schemes, like another scheme was also amended by the government, was Ayushman Bharat Health Data, in which government is storing the data of the every person which is registered through the Ayushman Bharat card, and that data stores for the improvement of the large scale of health facility. But I think, and writer is also said that only storing data is not sufficient. Government should increase the numbers of the hospitals and the staffs like nurses, doctors. Government also provide the basic health facility first of all, because we are seeing that the benefits getting from the Ayushman Bharat was that major diseases like diabetes, cancer, like death disease, means that are the critical diseases are getting benefit from that scheme. So despite that, government should focus on the basic facilities, improving the numbers of hospitals and staffs, and providing good amount of infrastructure like clean water, reducing poverty. That are the important, and providing nutrition. It is also another important factor plays in the well-being of the and health of the common people. So that was the main importance of this article. So going to conclude this topic, India is going towards a largest population country, and we have to be maintain our healthcare structure very supportive, not only rich but also poor people who are living in the remote area, because that are the major things. And government also promote sustainable health model. Like only changing the names of schemes and centers is not enough. On ground work like increasing the number of healthcare professionals, numbers of hospitals, providing basic services, that are the things that can definitely help to the India's healthcare system. Thank you.